So friends, welcome to Age Pharmacy, and today we are going to discuss about dextrose solution. Well, this dextrose solution contains sugar dextrose dissolved in sterile water, and dextrose can be in strength of 5%, 10%, 25% or 50% dissolved in 100 milliliters of sterile water. Generally, this dextrose solution is available in packing of 500 milliliters, but it can also be present in packing of 100 milliliters or 1000 milliliters, and its dose depends upon severity of condition of patient. Well, hypoglycemia is the main condition in which this dextrose solution is prescribed. In hypoglycemia, the concentration of sugar is below the normal. To lift that up, we need to prescribe this dextrose solution. It's also indicated in insulin shock. In insulin shock, the concentration of insulin in the body is too high. It happens because patient had received the insulin shot, but he had not taken the meal. So this dextrose solution is given there. It's also given in severe liver disease. Like in cirrhosis, the liver would not be able to process glycogen or fats properly. So at that time we need energy, and that energy is taken from this dextrose solution. It's also indicated to regain calories in dehydration, but make sure that dehydration would not involve electrolyte loss because it can lead to adverse effects. In diabetic ketoacidosis, along with insulin, this dextrose solution is also indicated there because in diabetic ketoacidosis, the body is not able to utilize glucose present in blood. It's taking energy from fats and is producing ketone bodies continuously. So at that time, we need to administer insulin along with this dextrose solution to cure him. Well, these were its uses. Now let us talk about its contraindications. Just like its uses are many, its contraindications are not also less. There are also many of them. Like it's contraindicated in hyperglycemia, that is high sugar level of blood. In diabetes mellitus, it's contraindicated there, but at sometimes there occurs sudden drop of glucose level. At that time, we need to prescribe this solution to patient, but make sure that sugar level would not go beyond normal. It's also contraindicated in intracranial hemorrhage. In intracranial hemorrhage, what happens is that there is increase in concentration of fluid in our brain. So in that condition, our main aim is to remove that extra amount of fluid, but rather to remove that extra amount of fluid, it will increase its concentration and will increase damage to brain. It's also contraindicated in dehydration involving severe electrolyte loss because it does not contain any electrolytes in it. It cannot restore the electrolyte levels of body, so it is contraindicated there. And also it can lead to hyponatremia, which can lead to cerebral edema. Besides these, it's also contraindicated in edemas, in anuria, and so on. These were the main contraindications which we should keep in mind while prescribing this dextrose solution to patient. And yet another thing, always remember to administer this dextrose solution under prescription of healthcare professional only. Don't use it at home as it can lead to severe side effects like hyperglycemia, intracranial edema. Yes, it can lead to dehydration, fever, abdominal pain, skin rashes, and so on. And also remember to talk to your patient if she is pregnant before prescribing this drug to her. So guys, this was a little bit about dextrose solution. I hope you got it well. Thank you very much.